All right, so we just spent a good amount of time on the family context, but now let's move beyond the parents and the immediate family because most children in the US are involved in some form of non-parental childcare, at least part of the time. So since many children spend time in non-parental care, we have to consider it as another context for development. So we're going to talk all about childcare in this context. So first of all, varieties of childcare. Let's talk about three types of non-parental childcare that we see. The first being home childcare. This is when care is provided in the child's own home, usually by the grandparents or other relatives while the parent is at work. So as the name implies, it's in the child's own home, but it's usually by a relative or grandparent that's doing the caring. In fact, nearly half of all children in non-parental childcare are cared for by family relatives. One thing to note is that children in home childcare experience the least amount of change from their normal routine. Remember, they're in their home still, eating foods that are provided by the parents, most likely, taking naps in their own bed. So there's not a whole lot of uprooting from their normal routine in this method of childcare. Also, they're usually not coming into contact with too many children of their own age in this type of non-parental care. So those are just some things to consider as we think about these different contexts for development. Next, we have family childcare. So this is when a child is cared for in someone else's home, either a relative or a non-relative. So I know the name can be a little confusing. Family childcare, we might confuse this with the first one because they are being cared for by relatives in home childcare, but it's called family childcare in this case where they're in someone else's home. So this often exposes children to new settings, caretakers outside the family circle, and children of other families. So they're seeing more diversity from their normal routine at home. However, the routines in family care are often similar to home care. Again, it is still in somebody else's home. It's not a formal setting, formal like licensed childcare, which we'll talk about next. So there are still some homey aspects to it, even if it's not their own home. So routines are similar, but still branching out more from home childcare. And lastly, we have childcare centers. So these are organized childcare facilities with licensed professionals. This accounts for about a quarter of children in non-parental care. So these programs will vary in style and they'll vary in philosophy. Some have more of a school-like atmosphere. They really emphasize academics and discipline. Some will emphasize social development and allow room for initiative, flexibility, and activities. Some of them really prioritize play. So there could be a number of philosophies and styles in a childcare center. Programs are also going to vary a lot in their quality, which makes a difference in developmental outcomes. So if we think about some features that contribute to a childcare program's quality, what might they be? We can think in the terms of just overall safety and how sanitary they are. Also, we can think about accommodations for special needs, the organization of toys and books and materials, whether or not they celebrate cultural diversity in the classroom, whether there's responsive caregivers, like they play with them, introduce new ideas, support their interests, appropriate child to staff ratios. These are all just potential aspects that can contribute to a program's quality. And these are all things that parents will often look out for. They'll look for specific criteria that they want for their child. So think about the type of non-parental childcare you were part of as a kid, if at all. Some people were raised entirely by their own parents, but majority of children have some form of non-parental childcare at least part of their lives as a kid. So just think about your own experience and what type or types, maybe you fell into multiple of these you experienced as a kid. I'll also say that licensed childcare centers are the most accessible for researchers to study. So the research we will discuss in the next slide is on childcare centers. There's not as much research on these first two. So the effects of childcare centers. Let's first talk about the physical impact. So one physical consequence is exposure to new germs. Children are suddenly spending their time in a new environment with a lot of new people who come from their own different environments. They're bound to spread germs in this kind of environment, right? So children under 3 years of age in childcare centers have higher risk for respiratory infection, gastrointestinal illnesses, and ear infections. These are some common things we'll see. Also, they're obviously more at risk for catching a cold or a flu bug. Again, going back to new people, new environment. However, there's no evidence that increased illnesses will negatively impact the child's overall development or their school readiness. So looking at kind of the big picture, there doesn't seem to be any negative impact. It's more, of course, dealing with these things on a short-term basis are not ideal, not fun for anyone being sick or having an ear infection, but there doesn't seem to be any long-term relations to long-term consequences of these things. In fact, there actually seems to be possible benefits on improving their immune systems by being in this kind of environment physically. Another physical consequence is stress, increased cortisol. So children experience more stress while in a childcare center, especially at first. How do we know? Research has shown that their stress hormone levels are increased, specifically cortisol. And what impact does this have? High levels of stress hormones are associated with decreased executive functioning in children in daycare. Executive functions, what is this? It's a higher level cognitive processes associated with things like self-control and flexible thinking. So decreased executive functioning creates some concern about whether daycare experience interferes with school readiness. This is one of the concerns out there. Moving into a different domain, cognitive development. So research specifically in the US and in Europe indicates that children in high quality childcare centers tend to be equal in their intellectual abilities as those raised at home by parents. Some research suggests that high quality childcare can be especially beneficial for children of lower socioeconomic status. These children are more at risk for decline in intellectual performance, which can be buffered by high quality childcare centers. This is a really fascinating finding that should be taken into consideration in the big picture. Now, in terms of social emotional impact, compared with children who receive home or family care, children that attend childcare centers, they tend to be more self-sufficient, independent, more verbally expressive, more comfortable in new settings, and more socially adept. So we see a lot of social emotional benefits. They also tend to be more enthusiastic about sharing toys and engaging in fantasy play. These benefits are not only due to interacting with a variety of playmates, caregivers also play a key role. Remember, these are usually trained caregivers that work with children on a daily basis. So, we needed to ask, are these caregivers monitoring and facilitating social play in a warm and responsive way? This can make a big impact. But these were a lot of positives, but not all social emotional effects of a childcare are positive. So some research suggests that increased time spent in childcare centers might be linked to increased aggression and decreased compliance and agreeability when they enter school at 6 years old. However, these differences do seem to disappear after a while when their peers who are exclusively receiving parental care spend more time in school. So this suggests that perhaps interacting with larger groups of peers gives more opportunities for expression of opposition and aggression. So aggression is a topic that's controversial, but opposition could be seen as a positive, right? Standing up for what you believe in. This could actually be seen as a positive by not being agreeable all the time. So you can look at this in different ways. Quality also seems to play a big role. So children in higher quality childcare had fewer aggressive behavior problems than peers in lesser quality care. So the common theme of all these findings is that high quality care matters. We do want to highlight that there is not a right or wrong whether a child goes to a child care center or receives home family care. All forms of care do have their own benefits, but we do have a lot of the research more so on these child care centers. But we do know that if a child goes to a childcare center, the quality does seem to make a big difference. So that concludes the different types of non-parental childcare. So our last stop of the day will be media context, but for now we'll stop here and thank you for joining everyone, and I'll see you in the next video.